We begin our program by revisiting a common condition that can have a tremendous impact on daily life: moderate to severe dry eyes. We talk with Dr. Thomas S. Tooma, Medical Director of Envision Eye Centers, about the prevalence and the causes of dry eyes.
About 11 to 17% of the adult U.S. population does have moderate to severe dry eyes. That's more than 20 million people. There are many things that cause dry eyes. Sometimes it's associated with systemic illnesses like autoimmune disease, rheumatoid arthritis, lupus. Sometimes it's associated with medications like water pills, whether people are dieting or for high blood pressure. Other things are like environmental causes. So if you're sitting in front of your computer for a long time, or you're out in windy, dusty environments. Allergy medications, antidepressants, diabetes, and hormonal changes past menopause are associated with a significantly higher incidence of dry eyes. But the majority of dry eyes are associated with a condition called meibomian gland dysfunction. And with that condition, basically you're not producing the oils that are necessary to prevent the tear film from evaporating. And so you're making tears, but they're just evaporating too fast. And that's about 7 out of 10 people who do have dry eyes have a condition called meibomian gland dysfunction or blepharitis. Most people with dry eyes have a foreign body sensation. They just feel like there's something there all the time. Frequently they complain of fatigue. Their eyes just feel tired at the end of the day. Burning sensation, a gritty feeling in the eye. All of those are common symptoms of people with dry eyes.
Dry eye doesn't always hurt. Sometimes your eyes can just be really red. They can look irritated, but oftentimes people do complain of a burning or a stinging sensation. So a lot of people don't realize they have dry eye. They're walking around with it.
They're always so dry. There's always a discomfort. There's always an irritation. And then it affects my life, the activities I do, my career. I always have to put eye drops in. I always have to make sure I'm wearing glasses or some sort of protection to protect my eyes.
So we now have the ability to actually assign a number to the severity of dry eyes, much like we'd assign a number to a patient's cholesterol level. And it's done by taking a small sample of a patient's tears and analyzing that tear for analyzing the osmolarity of that tear. The higher the osmolarity, the more severe the dry eye, and the higher the number. Osmolarity basically is an aspect of maintaining equilibrium in bodily fluids. And when that equilibrium is no longer able to be maintained or disrupted, which is called hyperosmolarity, that indicates basically disorder and could lead to disease. So tear hyperosmolarity is believed to be the central, or I guess the main reason why there's ocular surface damage and inflammation, thus leading to dry eye.
We ask about the non-invasive treatments and the home remedies for dry eyes.
Home remedies for dry eye can be effective depending on the, I guess, the severity of the dry eye. So home remedies may include warm compresses and lid scrubs, where you're asked to take a warm washcloth to the eye for about a minute or two to use heat to liquefy the secretions that come out of the oil glands of the eye. And those oils are important to keep any tears produced in the eye as opposed to evaporating off. Lid scrubs are often indicated when patients have bacteria buildup at the base of their lashes, and that bacteria can often cause inflammation at the base of the lashes, causing the eyelash lid margin to be reddened and to give patients symptoms of like a grain of sand in their eye.
One of the biggest factors that we find that people could be benefit from is just drinking water. They're dehydrated. Most people are dehydrated, and drinking enough water will help rehydrate the eyes.
Tranquilize is actually an eye hydrating system that was created for patients that needed more than 1 to 2 minutes of heat therapy to liquefy those oil secretions that we were talking about earlier. So it's an actual goggle that uses a reusable gel pack that creates heat that lasts a good 20 to 25 minutes. The gel packs are inserted into a goggle, and the goggle is placed around the eyes to provide a nice seal, to provide the heat needed.
Again, most of these home remedies are good for mild cases of dry eyes. When we get to moderate and severe dry eyes, we find that these things are insufficient to solve the problem.
Welcome back to this special Eye Health and Vision edition of the American Health Journal. We've been learning about some of the causes for dry eyes, as well as home remedies. But when these aren't enough, there's still hope. While we're talking with InVision founder Dr. Thomas S. Tooma, we ask about the advanced and surgical treatments for dry eyes.
The most common treatment, and that's what most people who have dry eyes use, is artificial tears. But most patients then find out that they're having to use them more and more and more, and the effect doesn't last as long. And so that's when we go into more advanced treatments. So beyond using artificial tears, there are some specialized medications that people use. One of them, where you hear advertised on television frequently, is Restasis. That's effective in increasing the amount of tears that are being produced. So that's a special segment of dry eyes that's called tear deficiency, where they're not making enough tears. But if you're making enough tears and they're evaporating too fast, that's called evaporative dry eyes. And that's where the oil layer that covers the tear film is not being produced. And that's because the glands that are supposed to make those oils are plugged up. And so what we do, the advanced treatments for dry eyes that are relatively new, are aimed to unplugging these glands and making them start working again. Intense pulse light is frequently used for skin rejuvenation, where we're using this very bright light at a special frequency and a special repetition rate to rejuvenate the skin and make it just glow and look better. But an ophthalmologist recently found out that when he was using that treatment on some of his patients, they came back and said that their dry eyes were getting much better. And what he found out was that the intense pulse light is actually working on the glands that produce the oil secretions that are preventing the tear film from evaporating and improving these secretions and making these glands work better. So that's why we use the intense pulse light, is for people that have meibomian gland dysfunction that is causing evaporative dry eyes. We've discovered that by using that, we're also able to heat up these oils that have become solid and plug up the glands, and we're able to express those oils with heat, with the heat of the laser, and by expressing the glands and getting these secretions out, we're finding out that that is substantially improving the symptoms of these patients because their tears are not evaporating fast anymore. A good candidate is someone who does have meibomian gland dysfunction, blepharitis, causing the evaporative dry eyes. So the patient needs to seek a consultation, obviously, with someone who's specialized in dry eye treatment and does have that treatment available. Typically, the IPL treatment is performed over 4 sessions, and the sessions are separated by about a month apart. And then we need a tune-up session, which is 1 session about every 9 months to a year after the first series of treatments.
I'm getting the IPL treatment in order to have a great outcome with LASIK. Having the treatment, having as much moisture in my eyes as possible before the treatment will result in hopefully the best outcome possible. The laser treatment is quick, and also once you get the extraction going, that goes pretty quickly too.
We wondered if there were other causes and treatments for dry eyes.
Sometimes these meibomian glands that produce the oils to prevent the tears from evaporating, sometimes they get actually covered and completely plugged up with a tissue that closes them up. And so we use a very thin probe that opens that duct, and that way the gland can start producing the oils again. The other thing that we are doing for people that don't produce enough tears is we're closing the drains for the tears. We call them the puncta. And there's one in the lower lid, one in the upper lid. So we're using cautery or heat to close that duct that drains the tears, so what little tears people make stay in the eye longer. Dry eyes can, especially moderate to severe dry eyes, can absolutely affect every aspect of your life. And so there are patients who can't work well because they can't see very well, they can't drive well, they're constantly in pain and discomfort, and it just completely makes them irritable and changes your whole life. In addition to not enabling you to see well. These treatments have made a huge improvement in patients who are basically at the end of their road, where there's nowhere to go because they've tried every drop on the market, every pill on the market, everything, and nothing has worked.
It's much better. I can't wait till I get all 4 treatments and I can get my LASIK.
It is really exciting to take care of some of the patients that we take care of who are at the end of the road, so to speak, because it changes their life, it changes their outlook. It's just like a new lease on life. They're just suddenly able to see well, go back to work, are able to go out and socialize and enjoy life again. It is life-changing. It definitely can be.